Hello, this is Dr. Adam Kopsky from Advanced Rehab and Medical, and this is part 2 of our two-part series on hip impingement. And if you have any questions on the cause, I went over that last week, so be sure to look back in the video section to look at that blog where I discussed it. What I'm going to go over today is just a little bit of activities of daily living that really interfere with this and things to avoid if you have this type of condition. Now, if you remember me going over this last week, a lot of the causes of this are congenital in nature, where when we're growing, the shaft of the femur grows abnormally and there's a mismatch, so it can lead to prematurely degeneration over time. So you really want to take care of this if you have any signs or symptoms of it, to just be aware of it so you can do things to help prevent it from getting worse. And so if you remember me saying last week, a lot of times if you try conservative care, because the research, when you look at it, there is no evidence that supports or refutes conservative care. However, it merits some consideration before opting to look at surgery. So one thing you guys can just be aware of that you want to avoid in this type of situation is, if I step out here, is a lot of time that aggravates it is hip flexion and internal rotation of the hip. So a lot of like overhead squats, you want to avoid that, and even simple things like getting out of the car where you move your hip that certain way, and even you swimmers out there that do breaststroke where you're putting that hip into that certain position, you want to avoid that. But a lot of times, one thing you can do at home is really you want to focus on things to help support the stability around the hips and even the core, to just take a lot of that stress off. So a lot of exercises that I've done in the past, if you look previously, are dead bug and bird dog for the core, and then even some clam exercises for the hip and single leg squats. So if you guys are ever interested at all, please comment in this video below and we'll be sure to get those exercises out so you know what you can do at home to at least help this condition. And maybe if you don't have it, if someone is experiencing some hip snapping issues, never put it off, because this condition is a lot of times misdiagnosed or diagnosed wrongly, and we want to make sure we do everything in your health to help keep you healthy, and be sure if you do have it to get evaluated. So I hope this helps. Be sure to tune in next week. I'm going over a blog on pillows, because we get a lot of information on what is the best pillows to use to keep your neck nice and healthy. So once again, it's Dr. Adam Kopsky. I hope you guys have a great week, and please comment below if you have any questions.